We are so glad you could join us for another episode of The Catholic View for Women here on EWTN, where we give you news and views from a truly Catholic perspective. My name is Teresa Tomeo. I am one of the co-hosts on this wonderful program. I also host a daily radio show right here on the EWTN radio network as well, Catholic Connection, Monday through Friday. Let me introduce to you once again my wonderful co-host, of course, Janet Morana, from Priest for Life, Defending Life here on EWTN, and the Silent No More Awareness Campaign. And to my immediate right, of course, my wonderful friend, Elena Rodriguez, who has been with the network for many years, working both on camera and behind the scenes, and joining us for her first season as co-host on The Catholic View. Great to have you.
Thank you.
This is a topic that can appeal to an awful lot of folks out there, especially women if they're single and they're struggling with certain types of maybe female issues,
right.
Women who are married and may have trouble conceiving, anyone who had questions about the fertility issue and maybe some of the teachings of the church. What we decided to do in this episode is spend time with a wonderful young doctor who trained under another amazing doctor, and that would be Dr. Hilgers,
right.
Out in Nebraska. And he has, of course, the amazing Paul VI Institute, and has done such great work with helping women, husbands and wives, actually getting to know how the body works, not only for fertility purposes, but for overall health. And so I actually saw an article in our Michigan Catholic interview with Dr. Nickole, and it was really beautiful. And she's very young,
Yes.
very dynamic doctor, but we spent some time with her not too long ago and asked her about her practice, how she got involved. What are your thoughts, ladies, on this
Well, I know
important
based
topic?
on our viewer response, one of the things that we get the most questions in this area is, my daughter's having problems, with her period or this and that, and I go to the doctor and they want to put her on the pill. And even when these girls are away from college, they want to put them on the pill. And of course, the mothers are very concerned. What can we do? Well, Dr. Nickole, being trained under Dr. Hilgers, has the right answer. It's not prescribing the pill for them. And actually what happens to Dr. Nickole is she gets the patients who are with other doctors that they want to give them the pill as the answer. And they say, but there has to be another answer. And she ends up treating them naturally, the Dr. Hilgers way, with NaPro technology.
On the radio side, the most frequent question from our listeners is mothers who are concerned the same way. They take their daughters to the doctor, young daughters, young teenagers, and they have migraines, and just because of a migraine,
They're pushing the pill. Let me guess.
The pill.
yeah, exactly. And the pill on a very severe regimen to be able to take care of those migraines.
Even acne too.
Even acne, correct.
is
For
another
common
one.
things like
common
that.
things, yeah. So Dr. Nickole is a real treasure, and other doctors all over the country. I mean, Dr. Hilgers has hundreds and hundreds of doctors who have now been trained at the Paul
And are
VI
starting their
Institute.
own practices.
Their own practices, yeah.
Well, let's take a look at what Dr. Nickole says. Her name is Dr. Nicole Baskar, and she actually works at Women's Excellence in Health in suburban Detroit. And we spent some time with her and chatted about her practice and also the growing practice of NaPro technology.
It started early on in residency, actually. I made the commitment before I entered residency that I would be practicing according to my conscience and the Catholic faith. And so I knew what my boundaries were going to be from the get-go, and then was interested in how can I, develop myself as a natural family planning only physician in order to, really fill that, that niche. So going into residency, I knew that I was committed to being natural family planning only and practicing in a way that was authentic to the Catholic teachings. And so, of course, I was always interested in keeping my mind open to mentors or physicians who were also on that path and taking advice from them as far as how to handle challenging situations where you may be in a moral or ethical dilemma. One of the neonatologists that I trained under, he had been a colleague of Dr. Hilgers for years, and he stocked our library at St. Charles in Oregon, Ohio, with the Medical and Surgical Practice of NaPro Technology textbook, which is a huge medical textbook for physicians. And I started exploring that and reading it, and I was very, very inspired, and I was so thankful that there was something like this that existed. It's kind of like bringing the desires of somebody who has the intention to practice natural family planning only to fruition, because it really fills the medical and the surgical part of that natural approach of wanting to work with and cooperate with the body, and also with the answers that God gives us through science, how can we cooperate with the menstrual cycle and make it more functional? And how can we address underlying causes of infertility and pelvic pain, and also develop special techniques to treat endometriosis? So once I got a hold of that textbook, I was totally convinced that this is now the direction that I need to head in. Now that I have the commitment and the devotion, the conviction to be natural family planning only, that was really the next step of how to elevate that type of a practice. So I started corresponding with Dr. Hilgers, and we made an arrangement for me to come out and do the medical consultant training, which is 2 different educational phases, 6 months apart. And I believe I did that in my 3rd year of residency. And I also ended up staying for a month during one of those visits to do the reproductive endocrinology and infertility portion of my training, which is typically done with an IVF practice in Michigan. And so that was a real blessing that I was able to customize my residency training that way. And, you know, one thing led to another, and he really was interested in recruiting me for the fellowship after my visits, and that's what I went on to do after residency. The practice that I'm with right now is a group, and it's led by an amazing entrepreneur and skilled clinician, Dr. Zayden, and he formed Women's Excellence, which is based in Lake Orion as well as Clarkston and Birmingham. And I came on with that group about 3.5+ years ago, and was really just given the support and the freedom to start building my practice within a practice, so to speak. And from the grassroots have been able to draw a patient base through word of mouth and through some minimal marketing, but it's just really grown in the way that something good would flourish and blossom. And so just now expanding into the Birmingham location is awesome, because it really lets me reach out to a greater radius into the Metro Detroit area, including the east side of Detroit as far as the suburbs. And I've been drawing from other areas, but it just lets me have more of a central location. I am osteopathic trained, which really at the heart of osteopathic training is mind, body, spirit, so recognizing the whole person and treating the whole person and not just the symptoms. So from a philosophy base, a holistic approach is really where I was coming from, you know, to begin with. And NaPro technology really, I guess, accentuates that and helps to nurture that foundation, because it's all about finding answers. So if we let the body tell us what's going on, and that could be either through charting with the Creighton model or just reporting symptoms and biomarkers, it really helps us to read into the situation, you know, and guide a workup. So the medical workups can be guided in order to be more fruitful in terms of the answers that we find. The birth control pill as a treatment, in theory, the thought of suppressing the menstrual cycles seems to be a logical answer, especially because from a practice perspective, it would be an easy sort of a treatment. You know, you don't have to do much of a workup, and it doesn't require much thought in the way of, you know, compliance. And you pretty much hope that it just suppresses the symptoms, which for some people it works for a while, but ultimately the women who are to the point of seeking and searching for NaPro, they want to know what's going on with their body. So now it's about exposing what's going on underneath the surface. And so that's kind of where the shift takes place. So where the birth control pill may be helpful for some women, or maybe it was the only treatment they were offered, the thought is to suppress the physiology and in turn get some sort of a therapeutic benefit. Whereas the NaPro is about, okay, what's going on? You give it some time to play out so that we can get a better understanding of when the symptoms are happening and what the severity is. And also what's a normal physiology, which is important too in terms of education. looking at the menstrual cycle and saying, okay, what is a normal inflammatory process and how much in terms of severity can you live with, and when does it start to become a quality of life issue to the point that your lifestyle and well-being is being impacted. So it's about reading the body, the anatomy and the physiology, and then we can offer workups and treatments that really address both the anatomy and the physiology. So in terms of heavy and painful periods, first of all, you want to make sure that nothing serious is wrong. Some women, just their baseline is prone to a little bit heavier flow than the next woman. And so again, we have to figure out to what degree can we tolerate those symptoms and look at them as part of a normal baseline. So there are treatments to lessen the flow. Once you find out what's wrong, you can try things that could lessen the flow, reduce, maybe the inflammation that could be contributing to those symptoms. But things like endometriosis or dysfunctional ovulation patterns, or maybe a lack of ovulation or infrequent ovulation patterns, what it does is it shifts the hormone balance. So there's not a natural, I always compare it to like a seesaw or teeter-totter where the estrogen and the progesterone are supposed to balance each other, and they each have their own respective dominant phases. And if that's off and the estrogen's not being opposed properly, you can end up with some dysfunctional bleeding patterns. And that's probably the most common one that I see is a hormonal imbalance. But anatomically, as far as endometriosis lesions, they can certainly make the periods more painful. I have patients who have tried oral contraceptives or Depo-Provera and just didn't like the way their body responded, whether that be weight gain or hair loss or continuous bleeding, or maybe they just felt like it wasn't really treating them. It's mainly a mainstay. But I have tons of patients that don't necessarily come from the education of having read about NaPro and knowing what they want, where they just simply mention, yeah, I don't want to be on the birth control pill, or I don't want to be on Depo, I've tried it. And so they're looking for something because of their previous experience. I do feel that I have the opportunity to evangelize, whether it be a fellow Catholic or a Christian or a patient who doesn't know my background and my training to a great extent, where it's just like, okay, well, this doctor's, sharing with me that she, is approaching creation in a respectful way. She wants to make sure that we are protecting and preserving life, or she's sharing with me something different than doctors have shared with me in the past. Or when I'm talking about natural family planning and the way that it can benefit their fertility and their overall health, but also their relationship. So it becomes it becomes a form of evangelization in that the conversation is not always just medical or scientific. It can also be about overall spiritual or mental or emotional well-being.
When we come back after our break, we're going to talk more not only about Dr. Nicole's ministry, which is a ministry for her, not only a profession, but also we'll take some of the questions that have come up over the years on the Catholic View for Women and on radio about the important topic of not only NaPro technology, but getting to know our bodies, how God designed them. We'll be right back, and you're watching the Catholic View for Women. Stay tuned. Welcome back to the Catholic View for Women. On this episode, Janet Morana, Elena Rodriguez, and myself are discussing with an expert on the topic, of course, Dr. Nicole Baskar from Michigan, about our bodies, how we need to know more about how our bodies operate, because we are made so beautifully, right, and magnificently, as we see in the scriptures. And God designed us for our bodies to operate a certain way. And when we go against the natural law, when we put in all these artificial things, especially things like, the birth control pill and others, things don't work right.
That's right.
And so there's a wonderful doctor who started something, and Janet, you know him very well, Dr. Hilgers.
Dr. Hilgers.
Something called NaPro technology. And now he has been training many, many doctors, including Dr. Nicole, and it's making such a difference in the lives of women and in couples as well.
Well, I also too want to make sure that everyone understands that Dr. Nicole does not prescribe the
birth control. She's completely 100% orthodox in her faith and her practice.
What she was referring to is the patients are coming to her after going to another doctor who just wanted to hand them the birth control pill as the answer to the problem and saying, I don't want to be on this pill, I'm having all these problems. Now they're coming to her to solve what is the problem. And that's what NaPro technology is about. It's looking at the body and seeing what's going wrong. And like she said, it takes more of an effort to diagnose and then just to script out the birth control pill. But the other danger I really want to remind people of, and I did a lot of research at this for my book, Recall Abortion, is that the birth control pills, women are dying from that. Particularly the pill Yaz and Yasmin that they're prescribing like crazy, especially to young teenagers for acne and all kinds of heavy bleeding, the things that Dr. Nicole was referring to. And you know, Teresa, that one time we were speaking at a conference, the woman right behind us on the lunch buffet line bubbled up with tears and said, "You're right, Janet. My best friend just buried her daughter."
Oh my.
And she was taking Yasmin. She said, and it's tragic because this was a girl who wasn't taking it for birth control. She was, she was living a chaste life. She was away at school. She broke out in severe acne in her freshman year. And she went to the campus health clinic, and they gave her a prescription for Yasmin. She called home to her mom and said, "Mom, I'm not sexually active. I've taken that promise of chastity. I don't even have a boyfriend, but that my face is a mess. The doctor said this will clear it up." The mother, because she had acne as a teenager too, remembered how terrible she felt. She goes, "Well, honey, okay, if it's just for that, okay." 3 months into taking that Yasmin, her roommate comes back and finds her collapsed on the dorm room floor. Rushed her by ambulance. She laid in a coma for 5 years before passing away.
Wow.
And this is from and this is just, there are millions of dollars of lawsuits that have been paid out by Bayer Pharmaceutical for taking. So besides the fact that God's way is the right way, the chemicals that are in these birth control pills, as you know, the World Health Organization said it's a group 1 carcinogen, but then women are dying from taking the pill. They're having strokes,
heart attacks. That was one of the most recent studies that came out was the heart attack, the connection between the pill and heart attacks.
And so the work that Dr. Hilgers has done for decades now, and actually it was St. John Paul II that charged Dr. Hilgers with doing this. One time Dr. Hilgers was in Rome at a conference, and the Holy Father said to him, "We need you with the science. We know the church's teachings, we know the beautiful Amani Vitu encyclical, but we need the science now behind it." And he charged Dr. Hilgers with, "Go please and bring me back the science." And that's what Dr. Hilgers did.
That is so important. On the radio side, we get so many phone calls from listeners who tell us, if I would have only known.
If I would have had the information.
Right.
And I'm the only thing I am sorry about is that I'm finding about this 10 years into it. If I were able to rewind back into history and stop this. And once you start disconfiguring your body the way God created it, it's very difficult to go back, but at least and you can put a stop to it. Picture an eye. An eye is created by God for seeing. An ear is created by God for hearing. If you start poking things into your ear and you break burst one of your eardrums,
you're not going to hear.
You're not going to hear.
Right.
So don't dedicate an organ of the body that God has created for something to do what it is not supposed to do.
Right. And the female reproductive system is beautifully designed. We're wonderfully made. But like Dr. Nicole said, there is a way to diagnose these problems with NaPro technology to treat it naturally. I mean, even for people who have trouble in conceiving. I mean, I know several women that actually used to work for Priests for Life, married and couldn't have children. They ended up going to Dr. Hilgers, and the problems were solved, and they were able to have beautiful children.
And also, if you noticed in the interview with Dr. Nicole, she was saying that there are women and patients that are coming to her, really, it's not necessarily for their faith. They're just really frustrated with their bodies and the way their bodies are reacting. But what's happening is this then gives her an opportunity, she told us, to in some ways witness. openness, because,
Yes.
well, you know, this is how God designed us, and to kind of talk to the women that come in.
Right.
You know, so it's
a
really
great way.
interesting.
It really
Yeah.
is.
Yeah.
Well, I want to remind everyone, we could maybe look at our homework for a
Sure.
minute. Just to spend a minute about Dr. Hilger's website, which is the PopePaul6.com, which is the website of Pope Paul VI Institute. If you go to that website, he does have a listing of doctors who have been trained around the country in
Right.
NaPro technology. So our viewers might be, how do I find a Dr. Nicole? Well, here's the way to do it. Contact Dr. Hilgers. Now also too, you can witness to your own doctor. If you know an OBGYN, maybe they would be interested in going out to be trained for a few months by Dr. Hilgers so that they would learn NaPro technology. So Dr. Hilgers is always looking to train more doctors. So we should be ambassadors of that
And
message.
you know, speaking of that, a lot of doctors struggled with making the decision when they came back to the church and decided they wanted to be completely, you know, in line with church teaching. They were worried at first that they wouldn't have a practice. Well,
right.
just the opposite has happened, because there's been so
blossoms.
many problems with birth control and especially the
Exactly.
pill, that women are so uncomfortable with what's going on that they're seeking out these doctors.
There's great demand.
Yeah, there's
Every
demand,
doctor I
yeah.
know, and Father Pavone and I, we travel all over the country. Every doctor we meet that has dedicated their practice like this to the Dr. Hilgers method, their practices flourish.
Booming.
Booming.
Yeah.
Booming. All right, well, so again, that's PopePaul6.com is the website. Please go there. Wealth of information. Of course, number 2, homework suggestion, identify one way we can use our degree or our training to work to protect the health of women, starting with our very own. So that means it's almost like a mandate to get yourself educated.
Right. Don't
You know.
just take the answers. You know, get a second opinion.
Second
and
opinion.
certainly, obviously, we know that birth control is an intrinsic evil, and we can't take it for that purpose.
that
Sometimes
purpose.
they're prescribed for medical reasons. But again, there is a reason that the church says no, not just because of the issue in terms of the relations and you know, preventing life, but because it's bad for you.
That's right.
It's not good for you, as you
It's
said.
like I say,
Yeah.
God's way is the right way.
Yeah.
Of course, number 3 in our homework is to visit our website, thecatholicviewforwomen.com. Sign up to get our e-letter, which we send out each month. Also, we want to hear from you. And that's how this show, again, was brought about, because of suggestion from you, our viewers. So we want to hear your comments and your questions. And then number 4, like us on Facebook. We have a fan page there, and spread the news about the Catholic View.
Yeah, and you know, with this website our website is so filled with information.
That's
Really
right.
take
Great
some time to
resources.
look at it. You know, go look at back episodes, look at the resources we have. Take some time to study, because we're putting this out there for your information.
right.
You'll be better off for it, as always. And again, that's the CatholicViewForWomen.com. Check out NaPro Technology, see what it's all about. And if you know someone maybe who is hurting from something that they're doing medically that isn't working right, send them over to Dr. Hilgers to talk to him, or someone like a Dr. Nicole Badger. Thanks for watching. My name is Teresa Tomeo again, along with, of course, Elena Rodriguez, Janet Morana, and on behalf of our wonderful pastoral advisor, Father Frank Pavone, we thank you so much for watching The Catholic View for Women. And remember that God made us a certain way. And when we go against nature's law, things don't, you know, work out. But we follow God, there's an answer, and there's plenty of experts out there to help you if you have questions. Thanks for watching. We'll see you next time on the one, the only Catholic View for Women.